Isn't it strange, sometimes, how your feet can feel so icy cold? Even when you're tucked up warm indoors, maybe reading a book? Or perhaps you've noticed a funny tingling sensation, like pins and needles, that comes and goes without any obvious reason. It's easy to dismiss these little things, isn't it? We often think, oh, it's just my circulation, or maybe I sat funny. And sometimes, that's all it is. But our feet, way down there at the end of our bodies, often get overlooked. Yet they can be incredibly insightful messengers about our overall health, especially as we navigate our 60s, 70s, and beyond. They carry us through life, step after step. And sometimes, they show the first subtle signs that something more significant might be happening elsewhere in our bodies. It's completely understandable to focus on the bigger aches and pains, maybe a stiff shoulder or a tricky knee. But paying a little closer attention to our feet can be surprisingly revealing. So, today, I thought we could chat about some of those less common, perhaps even unusual, foot symptoms that are worth paying attention to. Not to cause alarm, goodness no, but to empower ourselves with knowledge. Because knowing what to look for means we can catch potential health issues earlier, and that often leads to better outcomes and helps us stay active and independent for longer, which is something I know is important to all of us. We'll explore about 5 specific signs today. Things like persistent numbness, those stubbornly cold feet we mentioned, sores that take their sweet time healing, sudden swelling, and even changes in our toenails. It's all about learning to listen to what our bodies, right down to our toes, might be trying to tell us. Does that sound like a helpful conversation to have? Let's start with that tingling or numbness, sometimes described as pins and needles, or a feeling like your foot has fallen asleep, even when it hasn't. Of course, this can happen temporarily if you've been sitting in one position for too long, cutting off circulation. But if you experience numbness, tingling, or even a burning sensation in your feet regularly, especially if it seems to be getting worse over time or affects both feet, it's something to mention to your doctor. This is often a symptom of something called peripheral neuropathy, which basically means there's some damage to the nerves outside of your brain and spinal cord, most commonly in the feet and hands. Now, one of the most frequent causes of peripheral neuropathy, particularly as we get older, is diabetes. High blood sugar levels over time can damage nerves, starting with the longest ones that reach down to our feet. Sometimes, these foot symptoms are actually the very first sign that someone has type 2 diabetes, or that their existing diabetes isn't as well controlled as it could be. I remember talking to a friend, George, who'd been feeling this odd numbness in his toes for months. He kept putting it down to wearing old work boots, even though he was retired. It wasn't until his wife encouraged him to mention it at his annual checkup that he discovered his blood sugar was quite high, leading to a diabetes diagnosis. Getting that diagnosis meant he could start managing it properly, which not only helped with his foot numbness over time, but also protected him from other serious diabetes complications down the road. It's a perfect example of how listening to that small symptom made a big difference. Beyond diabetes, though, neuropathy can also be caused by other things, like a vitamin B12 deficiency, which isn't uncommon in older adults due to changes in digestion, certain medications, alcohol overuse, or even physical injury to the nerves. The key takeaway here is that persistent numbness, or tingling, isn't just an annoyance. It's a signal flare from your nerves that warrants a conversation with your healthcare provider to figure out the underlying cause. Another sensation many people notice is having feet that always seem to be cold, even when the rest of their body feels comfortable. You might find yourself wearing thick socks to bed year-round. Or maybe you notice your feet look paler than usual, or sometimes even take on a slightly bluish tinge. While some people naturally have cooler extremities, persistent cold feet, especially if accompanied by changes in skin color, leg pain during walking, that gets better with rest, or sores that heal slowly can point towards poor circulation. A common culprit here is peripheral artery disease, or PAD. This happens when the arteries that carry blood to your limbs, usually your legs and feet, become narrowed or blocked by fatty deposits, a process called atherosclerosis, the same process that can affect heart arteries. When blood flow is reduced, your feet don't get enough oxygen-rich blood, which can cause them to feel cold, change color, and sometimes lead to pain or cramping in your calves when you walk, known as claudication. PAD is more common after 60, and risk factors include smoking, even if you quit years ago, diabetes, high blood pressure, and high cholesterol. Think about someone like Eleanor, who loved her garden but found she had to keep stopping because of aching in her calves. She initially blamed it on getting older, but when her feet also started feeling perpetually cold and looking a bit pale, her daughter urged her to see the doctor. It turned out she had PAD, and starting treatment, including a walking program and medication, significantly improved her symptoms and reduced her risk of more serious complications like heart attack or stroke, because PAD is often a sign of atherosclerosis elsewhere in the body, too. Raynaud's phenomenon is another condition that can cause feet and hands to feel excessively cold and change color in response to cold temperatures or stress, though this is often less indicative of widespread artery disease than PAD. Regardless of the specific cause, if your feet are constantly cold or you notice those color changes, it's a clear sign that your circulation might need some attention, and definitely worth discussing with your doctor. And speaking of things not healing as they should, that brings us to another important sign our feet can show us: sores or little ulcers that just seem to hang around forever, or take much longer to heal than you'd expect. We all get minor cuts, blisters, or scrapes on our feet from time to time, maybe from new shoes, a bit of gardening barefoot, or just bumping into furniture. Usually, these heal up fairly quickly with basic care. However, if you notice a sore on your foot, especially on the sole, toes, or ankles, that doesn't seem to be getting better after a week or two. Or, if it looks infected, red, swollen, warm, or draining pus, this is a significant red flag. Slow healing foot sores are often linked back to those two conditions we just talked about: diabetes and poor circulation, PAD. Diabetes, as we know, can cause nerve damage, neuropathy, meaning you might not even feel a small injury when it happens. Think about stepping on a tiny pebble or getting a blister from a shoe seam. Without normal sensation, you might not notice it until it becomes a bigger problem. High blood sugar also impairs the body's ability to fight infection and heal wounds efficiently. Combine that with PAD, which reduces the blood flow needed to deliver oxygen and nutrients essential for healing, and you have a dangerous combination. A minor injury can quickly become a serious ulcer that is very difficult to treat. I recall a gentleman, Arthur, who was meticulously managing his diabetes but wasn't checking his feet daily because he didn't have much numbness. He developed a small blister under his callus after a long walk. Because his circulation was also somewhat compromised, though he hadn't realized the extent, that small blister turned into a stubborn ulcer. It took months of careful wound care and better blood sugar control to finally heal it. It really highlighted for him the importance of daily foot checks, even if things seem fine. Checking your feet daily, looking at the tops, bottoms, between the toes, using a mirror if needed, becomes incredibly important, especially if you have diabetes or known circulation issues. Look for any cuts, blisters, redness, swelling, or changes in skin. Catching something early, like a small red spot from shoe pressure, and addressing it, like changing shoes or protecting the area, can prevent a serious ulcer from forming. If you do find a sore that isn't healing, don't try to treat it yourself with harsh chemicals or ignore it hoping it will go away. See your doctor or a podiatrist promptly. Proper wound care is crucial to prevent infection and promote healing. It really underscores how vigilance with our feet can prevent major complications. It's a simple habit that can make a world of difference, isn't it? Moving from sores to swelling, another unusual symptom that definitely warrants immediate attention is sudden swelling, especially if it occurs in just one foot or leg and comes on quickly, perhaps over a day or two. We all might experience some mild foot or ankle swelling occasionally, maybe after a long day on our feet, a salty meal, or during hot weather. This type of swelling usually affects both feet fairly equally and tends to go down with rest and elevation. However, swelling that appears suddenly in one leg or foot, perhaps accompanied by pain, tenderness, especially in the calf, warmth, or redness in the affected area, could be a sign of a deep vein thrombosis, or DVT. A DVT is a blood clot that forms in a deep vein, usually in the leg. This is serious because a piece of the clot can break off and travel through the bloodstream to the lungs, causing a pulmonary embolism, PE, which can be life-threatening. Risk factors for DVT include recent surgery, especially hip or knee replacement, prolonged immobility, like long flights or bed rest, certain medical conditions, like cancer or heart failure, hormone therapy, and older age. Imagine someone like Brenda, who recently had knee surgery. A few days after coming home, she noticed her left calf and ankle were significantly more swollen than her right, and the calf felt tender and warm to the touch. Thankfully, she remembered the hospital warning her about DVT signs and called her doctor right away. She was diagnosed with a DVT and started on blood thinners immediately, preventing a potential PE. If you ever experience sudden, one-sided swelling like this, it's crucial to seek medical attention urgently. Don't wait. Go to your doctor, an urgent care center, or the emergency room. While DVT is a key concern with one-sided swelling, other possibilities include cellulitis, a bacterial skin infection, a ruptured Baker's cyst behind the knee, or lymphedema, though this often develops more gradually. If the swelling affects both feet and ankles and develops more slowly, it could be related to other issues like heart failure, where the heart isn't pumping efficiently, causing fluid to back up in the legs, kidney disease, or liver problems, chronic venous insufficiency, where the leg veins struggle to return blood back to the heart, can also cause persistent bilateral swelling. Any significant or persistent swelling in your feet or legs, whether one-sided or both, needs to be evaluated by a doctor to determine the cause and get the appropriate treatment. It's not something to ignore. Finally, let's talk about something we might look at every day, but not really see: our toenails. Changes in the appearance of your toenails can sometimes be more than just cosmetic concerns. They can hint at underlying health issues too. Of course, nails can change naturally with age, sometimes becoming a bit thicker or more brittle. And minor injuries or fungal infections are quite common. But certain specific changes are worth noting. For instance, toenails that become very thick, turn yellow or brownish, and perhaps become crumbly or distorted are often a sign of a fungal infection, onychomycosis. While common and usually treatable with antifungal medications, though treatment can take time, persistent fungal infections can sometimes be harder to clear in people with weakened immune systems or poor circulation. More concerningly, sometimes changes mimic a fungal infection, but aren't. Psoriasis, an autoimmune condition affecting the skin, can also cause nail changes like pitting, thickening, discoloration, and the nail separating from the nail bed. If you have skin psoriasis, nail changes are common, but sometimes the nail symptoms appear first. Another thing to watch for is nail clubbing, where the fingertips and toes enlarge and the nails curve around the fingertips. While this can happen gradually and be hereditary, New onset clubbing can sometimes be associated with lung disease, like lung cancer or chronic lung infections, or heart disease, as it can indicate chronically low blood oxygen levels. A rarer but very serious sign is a dark streak or band appearing in a toenail, especially if it's new, changing, involves the cuticle, or is only on one nail. While often benign, particularly in individuals with darker skin tones, melanoma, a new or changing dark streak can sometimes be a sign of subungual melanoma, a type of skin cancer under the nail. I remember reading about a woman who noticed a dark line under her big toenail and initially ignored it, thinking she'd bruised it. It wasn't until it started to widen that she sought advice and was diagnosed with melanoma. Early detection is absolutely key for melanoma. So, while not every nail change is serious, paying attention to significant shifts in color, yellow, brown, black streaks, texture, thickening, crumbling, pitting, or shape, clubbing, separation from the nail bed, and mentioning them to your doctor or a podiatrist is wise. They can help determine if it's a simple infection related to a skin condition or potentially a sign of something systemic that needs further investigation. So, as we've chatted about today, whether it's that persistent numbness or tingling telling tales of nerve health, the chilling cold or color changes hinting at circulation pathways, sores that stubbornly refuse to mend, signaling healing challenges, perhaps linked to diabetes or PAD, that sudden, alarming swelling pointing towards potential clots or heart function, or even those subtle but significant changes in the appearance of our toenails. Our feet really do try to tell us stories about our overall health. They are like early warning systems, sometimes picking up on issues before other, more obvious symptoms appear elsewhere. It's not about becoming overly anxious about every little twinge. Absolutely not. It's about fostering a gentle, proactive awareness. It's about honoring these incredible parts of our body that carry us through life and recognizing that they deserve our attention. Being informed about these potential signs empowers us to take action early, to have those important conversations with our healthcare providers when something doesn't feel quite right. And early action, as we know, almost always leads to better health management and helps us maintain the quality of life and independence we cherish. You're already taking a wonderful step just by listening and learning today. Remember, looking after your feet is truly looking after your whole self. Small observations can lead to significant positive steps for your well-being. Don't ever feel hesitant to bring up foot concerns with your doctor. They understand the connections and are there to help you piece the puzzle together. Keep listening to your body. It has so much wisdom to share, right down to the tips of your toes. What have your experiences been? Have you ever noticed any of these signs? Or perhaps other foot changes that made you pause and think? Sharing our stories and what we've learned can be so helpful for others navigating similar paths. Please feel free to share your thoughts or any tips you might have in the comments section below. Let's continue the conversation and support each other in this journey of healthy aging. If you found our chat today helpful or interesting, giving this video a like would be wonderful. It helps others find this information too. And if you'd like more conversations like this, focusing on staying healthy, active, and informed as we get older, please consider subscribing to the channel. We aim to share practical, encouraging information to help us all live well in these vibrant years. Thank you so much for spending this time with me today. Take good care of yourselves, and especially those amazing feet. I look forward to chatting with you again soon. Bye for now.